Hello again and welcome to part 2 of our presentation on the CDC's strategic plan to address the U.S. oral health problem. Part 2 consists of the CDC's oral health goals and of Healthy People 2020, where we will discuss how the CDC is integrating their plan with the goals of Healthy People 2020, which is a national health promotion developed by the Department of Health and Human Services. As we discussed in part 1, the strategic plan the CDC has developed consists of 8 goals. Number 1, prevent and control dental caries, cavities across the life stages. 2, prevent and control periodontal diseases. 3, prevent and control oral and pharyngeal cancers and their risk factors. 4, eliminate disparities in oral health. 5, promote prevention of disease transmission in dental healthcare settings. 6, increase state oral health program infrastructure, capacity, and effectiveness. 7, increase the use of cross-cutting policy development and translational approaches to promote oral health. And 8, assure an effective organization. Both Healthy People 2020 and the CDC Oral Health Plan addresses these areas of concern. So what is craniofacial disease? It's the disease of the skull and face. Types of oral and craniofacial diseases: tooth decay, gum disease, cleft lip and palate, oral and facial pain, mouth and throat cancer. So as what begins as acid breaking down one tooth, if left untreated, along with other risky behaviors such as smoking and poor nutrition, poor oral hygiene, it can all lead to serious consequences. That is why this promotion is very important. Healthy People 2020 is a 10-year national objective for all Americans, developed by the United States Department of Health and Human Services in Washington, D.C. The goal is to educate, create awareness, develop, implement effective health programs for all. The CDC Oral Health Plan complements much of the goals and objectives of Healthy People 2020 when it comes to oral health. The goal for Healthy People 2020 is to prevent and control oral and craniofacial diseases and injuries and improve access to preventative services and dental care. There are many goals of Healthy People 2020 the CDC Oral Health Program is addressing through strategic planning. One goal, as described here, is to prevent and control dental caries or cavities across the life stages. Healthy People 2020 is doing so by implementing programs to reduce tooth decay among children, teens, and adults. Also by interventions that will increase dental sealant procedures for children and teens. Another goal for the CDC that mirrors that of Healthy People is increasing state oral health capacity and effectiveness. Healthy People 2020 is doing this by increasing the number of states with dental health programs, increasing local health agencies with dental programs, and by monitoring systems that increase the number of states with systems which monitor cleft lip and palate. Programs like these promote overall health and oversight to ensure the health of our communities and our nation. This concludes part 2 of the CDC Oral Health Program presentation. Thank you so much for your time.